The Biden administration announcing it'll offer free COVID booster shots for all Americans 18 and older.
This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines.
Boosters are set to roll out the week of September 20th. That's when adults can start getting their third shot 8 months after their second dose of either Pfizer or Moderna. Surgeon General Vivek Murthy says he expects a booster for Johnson & Johnson, which was authorized after the other two vaccines, at a later date. So how important are these boosters, and should you get one? Everyone has so many questions. One person with answers is Dr. Robert Tiballi, an infectious disease specialist with the Catholic Medical Association. I asked him if the booster shots are necessary.
Well, to answer your question directly, they're going to be pretty necessary because what has been found is that the antibody response that people carry from the full vaccination series, the two-shot series, in most situations, that tends to wane over time. Now, they've been following patients that have gotten vaccinated to see how well their serum antibody levels are and about how well they neutralize the virus. And it appears that people do need a boost in their in the vaccine series around 6 to 9 months. Now they picked out 8 months, so that's kind of where we're going to be at. So the boosters raise the antibody levels about tenfold. This is kind of interesting because in comparison to natural infection, if someone gets one of the messenger RNA vaccines after a natural infection, it seems to raise the antibody levels over 100 times. Now, the booster will probably be the same vaccine that people have gotten in their series, and that's going to be the standing recommendation.
And that was one of my questions. A lot of people are wondering, if I got the Johnson & Johnson vaccine, can I get the Pfizer booster?
Technically, from a theoretical standpoint, it appears to have some advantage to mix and match the vaccines because they're all a little bit different. So if you had Pfizer, maybe getting a Moderna booster would be better, or if you got a J&J, maybe getting a Moderna or a Pfizer booster might give you enhanced immunity, a little broader immunity. But the big thing is, this is all a government-sponsored program, and they have rigid guidelines. And I believe they're not going to allow the mix and match at this time. You're going to get the same vaccine that you had in the original series.
All right, interesting. Now we've reported on the Delta variant and the Lambda variant. Now we're hearing about a new variant they're calling right now B1621. The Surgeon General says they're trying to stay ahead of the virus with these boosters. Can we stay ahead of this virus?
Well, the attachment site remains the same, but the virus may be changing a little bit in the development of the protein that it uses to attach to the human receptor on a human cell, such that the antibodies might not be nearly as effective, or they might be blocked from the target site. So there's been some, significant concern in the scientific community. But as of right now, today, in August of 2021, the antibodies that the vaccine develops are quite effective. There was a recent study out of the Mayo Clinic that talked about the effectiveness dropping tremendously to 76% and 46% for the Moderna and Pfizer vaccines, respectively. But that was people getting infected, period. That was not 76 and 46% against serious illness and hospitalization or death. That was just getting infected. The vaccines still remain highly effective, over about 90% or above, against serious infection, hospitalization, and death.
All right, last question I have. What about the ethics of all of this? Here we are in the US about to get a third shot when some poor countries haven't even started the first round.
Well, yeah, that's a difficult question, calling that, equitable distribution. Not to be self-centered on the United States, but when the United States is healthy, it helps the whole rest of the world, because so much of the rest of the world depends on what economic activity here, scientific activity here, and so on. And the vaccines were developed here, but I do know that we are shipping hundreds of millions of doses around the world at this time. So we do want everyone to get vaccinated as soon as they can, though.
All right, Dr. Robert Tiballi, always good to talk to you. We learned so much. Thanks for joining us.
Thank you.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.